My name is Eva Jordan-Johnson, and uh, I asked stroke for that. I asked stroke for healing. Okay, and thank you so much for joining this morning. And in the comments, put where you're joining from, with our audience. Okay, okay, and thank you. I have a special guest today, and she will be introducing herself. So tell people about, first start with their name and just do a brief introduction.
Okay, well, my name is Karina Martin, and I am a stroke survivor. And this May, at the end of May, will be 4 years that I have that I had my stroke. Yeah.
Okay. Thank you so much for joining us today. Tell us your experience. For me, I was celebrating. I did. I had celebrated my third year having a stroke. It's 3.5 years, and it would be in January that I had a stroke too. But what kind of stroke did you have?
I had a hemorrhagic stroke, so I believe what makes that different from ischemic stroke is I had 2 bleeds in my brain, and I had to get a 3.5-hour surgery to remove the skull from my brain to stop the bleeds, and then I had to have another surgery 3 months later to put my skull back in. The reason to leave it out is because the swelling in my brain had to heal.
Okay. Why did you have a stroke? Tell us why you had a stroke.
So I had a stroke just after I had my baby, which is Livia, and I had a C-section, and I had a normal pregnancy, other than being high risk because of my age, and I was released from the hospital, discharged like normal, and I spent one night in the home, and then I was able to go out to lunch with my family, and on my way home, I started having what would be best described as the worst headache of my life. So it was so very intense, and after an hour of doing all the things, taking a shower and, all the things that we tried, my husband said, we have to go to the hospital because I've never seen you like this. So he packed up our 3 kids and brought me to the hospital. And of course, he waited outside for me because an infant isn't the greatest place for her to be. So they checked my blood pressure as soon as I walked in, and they couldn't understand if it was because I was so upset, because I was really upset when I got there, or if my blood pressure was truly high. So they took me back, and by the time, all that happened, my husband had his mom pick up our other 2 children, and then he was headed in with our newborn. So 30 minutes later, I started showing signs of a stroke. Thankfully, he was in there with me. And I remember my first MRI CAT scan, but I don't remember my second one. I remember not being able to answer questions, and that's the aphasia setting in. So I had aphasia also. So I had trouble with getting my words out. And then I was intubated and flown to ORMC, which is a #1 trauma center. And I had a 3.5-hour surgery to remove my skull to relieve the pressure in my brain and stop the 2 bleeds.
Okay, I have a question. Let's go back a little bit. You said your children were there in the
Yes.
emergency room. How did they react?
So they didn't actually go inside. His mother was in town because just to see the baby. So she was able to pick them up and, bring them home. And then my husband had the baby. And so, yeah.
That was a God moment. That your mother was there to
Yes.
take care of the kids. God, you didn't know. Your husband didn't know what God knew.
Yeah. Yes. It was a God moment. And, I've seen God moments throughout my recovery. So I'm thankful to him.
Amen.
Yeah.
Go ahead.
So, so I was breastfeeding at the time. So the hospital was very helpful in getting, our newborn formula, and then my husband brought the baby. I don't know exactly what he did. So, but I know that my husband went straight to the hospital. So whether he had, his mom come back and pick up the baby, him and his brother drove in the car downtown Orlando while I was helicoptered, and they met me in the Bay, and then they saw me off to the 3.5-hour surgery.
Okay.
Mm-hmm.
I'm good. Thank you for sharing your story, because people think that it only happens to older people, but it can happen to younger people.
Yes.
Thanks for sharing your story.
Yeah, thanks for having me. And I want to also say that it was caused by postpartum eclampsia, which a lot of people don't realize that after you have a baby, you can have this up to 4 to 6 weeks after giving birth. Preeclampsia is during the period where you're pregnant and have a baby. And so if your preeclampsia gets out of hand, then they'll take the baby early, and then it's everyone thought for a while that the cure for preeclampsia was to give birth. But that was not the case for me, or the case now that they're finding out. So you can have it up to 4 to 6 weeks after giving birth. Yeah. So it's important to check your blood pressure, and if you have any sort of complications during birth or after birth, they give you all this information. But before my stroke happened, they weren't sending home any indications that something like this could happen. But now I'm proud to say that my story got shared to the right people, And now South Lake send their high-risk patients with a bag. Well, you know what? I'll show you the bag. Do you have a minute?
Yes,
Yeah, all right.
I do. I'm so thankful to share the story of about her experience for having a stroke and share with us what to do if you have one.
Yeah, so they made this really cool bag that goes home with every um, mom that just had a baby.
Oh,
And I don't know if it's only high risk women at this moment because it takes grants and things. So but I know this goes home with every high risk pregnancy after giving birth. So this is a post birth bracelet,
okay.
and they're told to wear this after they leave the hospital. And then some reasons why, and a blood pressure diary. So
Oh, that's very good to know.
they get to check their blood pressure, and these are the signs. Postpartum eclampsia is on there, but yeah. And then, all the risk and signs of preeclampsia.
Oh, good information. Good
Yeah.
information. See,
And then
okay.
you have this little magnet for your refrigerator to, save your life, get the care for these post-birth warning signs. So, and then this information packet, which tells you all about hypertension, and they actually get to tell a doc 10 days after birth, and they report to a nurse, and they share their blood pressure and everything.
That is wonderful. See, you can make a difference. One person can make a big difference.
Yeah.
Big difference.
Yeah, I mean, it got to the right people, and I'm so grateful because even if I save one life, then, my purpose is to give people hope and to spread awareness, and yeah, that's it.
Well, thank you so much for sharing. That one person can make a difference. And thanks for sharing the thing. I met Katrina as a result of the yearly stroke recovery group out of Orlando. So even in the future, I will do a thing on why you should attend the groups, because it's so helpful. You meet some amazing people.
Oh, yeah.
Amazing. Thank you so much, Katrina, for sharing with us. Thank you. And
You're
if
welcome.
you do not understand me, ask me to repeat myself in the comments.
Oh yeah.
So I want feedback is a gift from you to me. I know that I have some aphasia, but the more that I talk, the better I will become.
Yes.
So
Yes.
thank you.
And you know what?
What?
You don't even realize it, but the tiny steps that you're taking every day is getting better and better.
Amen.
Yes.
It's hard, but it's worth it.
Yep. It's worth the hard work. And you know what? And just keep going because you'll get better.
Okay, thank you. That's it. And thank you again. I hope that this has been an encouragement to someone. I hope this has been an encouragement. And remember to subscribe and Stroke for Healing. And not just to anyone, but to anyone, to people that this can be helpful to. We both want to be helpful to others because you never know. Tomorrow is not promised. So thank you so much. And you are a blessing to us. Be a blessing to someone else today. Bye for now.
Thank you for having me.
Okay.